Welcome. I'm Rich Connor. I'm the publisher of the Fort Worth Business Press. And our webinar today, Potential After the Pandemic, Reimagining Our Community. It's our pleasure to sponsor this webinar along with our primary sponsor, the United Way of Tarrant County. We've got a great group of panelists and ought to have a wonderful discussion on kind of where we go from here. What we learned yesterday when we met briefly with the panelists is this group is no stranger to Zoom meetings. It turns out that Judge Glenn Whitley, one of our panelists, has been holding one of these every Monday with a large number of community leaders as they have, in fact, led us through this pandemic. The future is clearly brighter, and we'll look forward to them telling us about what the past has taught them and what the future looks like. I would be remiss if I didn't put a plug in for the business press. We got a tweet yesterday from somebody that said, if you're for full transparency, who funds you? I wanted to write back that I did, but it's not quite true. All of our revenue comes from advertisers and subscribers, and very easy to subscribe to our website, our daily newsletters at fortworthbusiness.com. That's the end of my commercial. I'll now turn it over to our moderator, our editor, Bob Francis, and he will introduce you to Judge Glenn Whitley, County Judge in Tarrant County, Mike Sanborn, who is the CEO of Baylor All Saints, and a special thanks to Leah King and the United Way for sponsoring this event with us. She is, in fact, the president and CEO of the United Way of Tarrant County. We look forward to this discussion. Thank you.
Good afternoon and welcome everyone to Reimagining Tarrant County, What It Takes to Rebuild from the Pandemic, sponsored by United Way of Tarrant County. All three of today's panelists, as Rich introduced them, have been key in our community's response to COVID-19. And this webinar is a chance to not only hear from these leaders who have been involved in this response, but it's also a chance for you to ask them some questions. So we want to hear from you. And to do that, the easiest way to do it is to use the Q&A button that's likely located at the bottom of your screen, and we'll get your questions asked. The answers may vary, but we'll see what we can do. So to begin with, I'd like to ask this of each of you, but I'll start with Leah King. I wondered if you could each discuss a little bit about how you first became aware of the pandemic and then how you began to prepare your organization to respond. Leah, would you like to say a few words?
You bet. First, just thanks for having us today. We're really excited to participate in this, especially alongside dear friends, Judge Whitley, as well as Mike Sanborn. Let me tell you a little bit about when I first heard about the pandemic. It was probably in late January, early February, when we started to hear rumblings that not only was it happening, but there were some initial cases identified here in the US. And at that time, I had been traveling quite a bit. I shortly before then had been promoted to CEO and had been to United Way Worldwide in the DC area. And at that time during traveling is when I started to hear about this highly contagious virus. Fast forward about 4 or 6 weeks and returning from one trip. And I remember sending a note out to the team saying, if you are not in the habit of taking home your laptop every day, get in the habit of doing so, because we don't know if and when we will be told to shelter in place. And lo and behold, our last day in the office was March 13th, 2020. And so what we needed to do was to secure our team, to make sure that we had ample resources from a financial perspective. So to check in with the CFO and check on our liquidity, make sure that we could do what we needed to do to handle payroll, but also to meet the financial obligations that we had to our nonprofit partners. We also needed to make sure that we had the digital tools in order to continue successfully reaching out to the community. And so it's one thing to say, oh, we have mobile phones and email and all of that. But when you start thinking about some of the legal documents and the other things that you need to be able to move back and forth safely and securely through the organization, we wanted to be sure that we had our IT situation in a good place, at which we did. And then lastly, we had to be sure that the community knew that we were here and what we were here and prepared to do. And so we set out on a pretty aggressive, outward reaching communications campaign to be sure that the folks that needed help knew that we were here and available. So that might be anyone from our nonprofit partners to also just other community stakeholders. We reached out to the county, to the multiple cities, and let them know this is what we're up to. This is what you can expect from us. And then should you need anything, please alert us right away. So just a few things that we did shortly after learning that we were going to be sheltering in place.
Was this pre-lockdown or post-lockdown? The reason I asked that is I wondered if you changed how you communicated with people as well.
Well, I'll tell you, I have never texted people more than I had post-lockdown. You know, for me, it was kind of an informal type of manner of communication. But when you're dealing with the need to get information out quickly, sometimes it's the most effective manner. So email and those types of tools were effective. However, the volume of email that was happening during those early days was overwhelming. And so sometimes it was necessary to if you couldn't get somebody on the phone, to send them a quick text so that they would have the information at their fingertips. So pre-lockdown, we didn't do that as much, but right at the midst, and actually the day we shut down, I'll never forget, I sent a text to Judge Whitley and to Mayor Price to say, this is my cell phone, please save it, and here's what we're going to do, and please let us know what you need.
Well, I hope you had that data plan that lets you send as many as possible. So.
Thankfully, yes.
Okay. Judge Whitley, what about you?
Well, we probably first began to hear about it around December of 2019. Apologize the voice, it's allergies are terrible right now, so you're gonna hear me kind of go and come and be a little bit scratchy. In January, February, our public health director was, alerting us to what was kind of on the horizon. We began to, watch New York very closely, began to see the problems they were having keeping their hospitals open. And so around the first part of March, I remember one Friday having a call with the mayors and saying, okay, we're at the point where I think I'm fixing to have to issue an order to shut down all but essential businesses. And, we were kind of having this conversation, and I remember, someone said, well, I guess that means we're going to close down the hair salons and the barber shops. And I kind of said, okay, wait a minute. Before I shut down the hair salons and the barber shops, we're not going to just have a, tell me if you're against it or for it, we're going to have a vote. Because I know from my mother-in-law how important it is that she gets to go to that hair salon. And I wasn't looking forward to going home that weekend and telling her she wasn't going to get to go. So, we went through that. And I guess what that is, it's a sign of kind of the way I tried to handle many, if not all, of the decisions that I've had an opportunity or had if you want to call it an opportunity to make over the past year. As Leah mentioned, as Mike mentioned, for the last year, every Monday morning, we've had a call with probably about 15 different groups of agencies. We've had hospital CEOs, emergency managers. We've had physicians. We've had folks from the homeless community, from the volunteer community, childcare, mental health, businesses, Texas Workforce Commission, our various chambers, nursing homes, and then also the United Way. And what we were doing at that is to try to get a good understanding of what needs they were experiencing. And, the mental health would tell us, okay, our call center, here's the kind of calls we're getting. It started off with, fear of getting COVID. And then it was, okay, unemployment. And then it became just a general depression for the length of time. So there were a lot of side consequences to every decision that was made. And so I tried to have as many conversations with these folks and to have a little bit better idea of the consequences of some of those decisions. Same week, we would always have a call with the mayors, school superintendents, school board members, city managers. Throughout the process, what I tried to do, one priority was keep the hospitals open. Throughout, from beginning till end, that has been the number one priority. And number two, to try to keep the businesses open as much as possible. So we've also had weekly calls with the CEOs, and they kind of helped us to, understand exactly where they were and kind of what they felt like the process was at that time.
Can you give us an example of something you learned in one of those calls that you say didn't know before that you had to take care of, something that was brought to your attention?
Well, it was some of the stuff with getting food to the people who were shut in, or the people who were, if you're not in school, a lot of those kids couldn't get food. And so it was making sure that we worked with Tarrant Area Food Bank, Meals on Wheels, the schools, United Way, Catholic Charities. All these groups came together. When we would mention that we had a problem, they would all come together to find a solution. And if I said, if anything came out of this last year, I was continued to be amazed, not so really surprised, because we've shown that spirit of collaboration and generosity before. But these folks, tell us a need, and we're going to do what we can to find a way to solve that need. And it's been that way throughout the whole process. So again, I think it's been a collective effort. We went first from how do we get tests, then to now how do we get vaccines, and we've just continued to try to work with one another and help out as much as we could where we could.
All right, thank you, Michael. It's part of one of the largest healthcare organizations around. Tell us your experience in learning about the pandemic, and then what actions your organization took.
Well, I think, like Judge Whitley, I think I started hearing about it in December. There wasn't a lot of information at the time coming out of Asia, but for me, it wasn't really until it hit Italy and you started seeing the really high death rates kind of in January and in early February, and it quickly spread to Europe, that I think we realized that this is not just your ordinary flu virus. This is something that is significantly greater than that. So organization-wide, and I know this is true at the other hospitals, because I think one of the best byproducts of this entire pandemic has been the collaboration with the other leaders at the other facilities, competitor and non-competitor. None of us were competitors when it came to this pandemic. And, we all started talking about what we need to have in place. What do we know about it? What don't we know about it? What treatments do we know might work? All those kinds of things to try to educate our people. And then, when cases started happening in New York area, New Jersey, those states were hit really, really hard early on. I think that's when it really started to become real for everybody in the United States, and on the West Coast as well. If you remember, Seattle and some other cities got hit really hard in the very beginning. And so it was March 10th when the very first Tarrant County patient was identified at this hospital. And I'll never forget that day either. I remember talking to the pulmonologist, and he said, "Mike, I think this is what we think it is." And we waited, and sure enough, the test came back positive for SARS-CoV-2. And so that's kind of how everything started. And I think what is amazing to me, I've said this to a lot of folks, if you would have told me back in January, even when Italy was having challenges, that every single thing that we do in the hospital in every possible way you can imagine would be different in a few months, I would have just laughed. But it has literally changed everything we do. Like Leah talked about, we've had some people that have been able to work from home, but for the most part, everybody still had to come to work. We still had a lot of patients to take care of that weren't COVID. And then we knew that we had probably a coming onslaught based on what some of the other states had experienced. And so part of it was trying to retool based on this brand new patient population. one of the biggest challenges that all hospitals experienced very early on is, every hospital has a lot of surgical masks and masks of all kinds. N95s, not so much, but we have them. But to outfit every single person with multiple masks every single day to protect them, because that was really one of the most important things, was we need to protect our people so that they're not getting sick, but more importantly, that they're able to help us take care of the sick that we know are coming. And so just acquiring PPE for our entire organization was an incredible endeavor, and trying to make sure everybody had what they need. And it was an issue for every company. I know Judge Whitley and Mayor Price and so many others were involved in just trying to help get PPE out to everybody. So that was a big, big deal. There were just so many other aspects of this that evolved over time. We certainly know a lot more, obviously, today than we did back then, but almost every day there was something new that we had to identify. It was difficult for us, for example, to close the hospital to visitors. We believe very strongly that visitors help our patients get better. And that's kind of been a culture of ours, but every hospital in the country, because of safety reasons, you didn't know if that visitor was positive. And you didn't honestly at that time know, because testing wasn't as prevalent as it is now, if the patient was positive. And so out of an abundance of caution, we eliminated visitation for quite some time, and have since brought that back in a very cautious way. But there were so many other aspects to our traditional care models that we had to abandon and go under more of a highly infection control type of process. And I think for all of us, that was one of the biggest challenges.
But what, in terms of treatment, and treatment has changed over time and continues to change, I think, for these patients. How did you handle trying any innovative treatments for some of these patients out there?
Yeah, we had, there were some literature reports of various things that worked and didn't work. Most of it coming out of Europe. That's how the hydroxychloroquine got started. And there was some anecdotal evidence, mostly out of France and Spain, that it might have some impact. And so people don't remember this, but the FDA actually issued an emergency use authorization for hydroxychloroquine for a short period, and then rescinded it once it became apparent that it really didn't work as well as people thought. There have been a lot of other associations that people identified. For example, if you were taking ivermectin, you may or may not have more or less symptoms. Well, there have now been studies to show that really ivermectin really doesn't work very well. But for a long time, clinicians of all kinds were really kind of grasping at anything that we thought might help. One of the most interesting things, I think, that most people probably aren't aware of, but when you started to have severe breathing problems associated with this virus, which was a high number of people, one of the best things that you could do did not involve drugs at all. It was just literally laying on your stomach. And for whatever reason, that's called proning. We prone almost every single patient because it helps them breathe so much better. And there aren't a lot of diseases where proning really becomes a primary therapy. And so it was just interesting. There were so many things like that related to this virus and the way it went after the immune system that we had to learn. And so since then, we've had a lot of other therapies come about. The first big one for us that, and we were the first hospital in all of DFW to use it, were the monoclonal antibodies. And they've been shown now dramatically to reduce not only hospitalization, but death. And so those have truly been a godsend. And then, of course, shortly thereafter, the vaccines started becoming more available. And so being able to roll those out has certainly been helpful too. So it's kind of been a learn as you go, because this virus behaves very differently than most other viruses that we had treatments for.
Yeah, very, very interesting. I have a question. I'll ask it here since we're sort of on this topic. Question about how closely did Tarrant County collaborate with Dallas County on decisions related to business closures? That's probably one for the
Leah,
judge.
are you going to answer that one, Leah?
I got it. We
We would talk, but we didn't collaborate. We we approached it from a different aspect. And that's really all I can say. I think both of us did what we felt was the best for our particular community. As I said, I was constantly talking with the CEOs of the hospitals. They were assuring me that the hospitals were open and were going to stay open. And so I was not quite as dramatic on shutting down businesses as Clay was over in Dallas. I think the one thing we learned pretty quick, and Mike just alluded to it, is flexibility. CDC would change as they would learn. Every day we learned a little bit more about the disease. And not only did CDC keep changing, but I remember one of the calls that I was on with the hospital CEOs, and one of them said, we're learning how to treat it. And in the beginning, they would try whatever they could think of. And after a few weeks, they began to see what things were successful and what were not so much. And so that helped us in our hospitalizations and getting people in and out of the hospital. And, I guess if I learned one thing over the last years, don't ever say never, because flexibility was critical in dealing with the pandemic.
And Bob, maybe if I could comment on that.
Sure.
From my perspective. It bothers me a little bit when you compare a county to another county of any kind, even if they're next door to each other, because Dallas County's initial case rate was dramatically higher than what was experienced in Tarrant County. So doing the same thing in Tarrant County didn't necessarily make sense. And to Judge Whitley's point, usually 2 or 3 times a week with the mayor, we would have conversations. The hospital presidents in Tarrant County would have conversations about how are you doing, what's your capacity look like. And so I really feel like from the very beginning, our responses were very evidence-based, based on what was happening in the facilities at the time, because to Judge Whitley's point earlier, the goal for any community was to make sure that the hospitals did not become overwhelmed and overrun. And I think we did a great job managing that very early on. And I literally remember, and Judge probably doesn't remember because he had so many phone calls about this, I remember exactly where I was when Mayor Price and Judge Whitley asked the hospital presidents in the medical district, is it time to shut down businesses? And we all collectively said, yeah, we think it's finally time. We had said no for many weeks prior to that, because we really didn't want to hurt those businesses, because we know the impact that it's had. It's devastating. And I remember exactly where I was when we all felt like we needed to say uncle when the case rates were really starting to soar.
Bob, if I might, I know that this isn't necessarily a comment about the businesses from my perspective, but I do want to make sure that I share that the coordination that did happen, especially amongst the nonprofit and philanthropy community. Very quickly, a single website was made, northtexascares.org, to have a single portal for nonprofits to go to apply for funding from corporations, family foundations, United Ways, and the like. And that was an effort to make it as easy as possible, because we knew that at the time that many of them were experiencing substantial stress and strain on their internal resources, that filling out 15 different applications to apply for funding wasn't going to be feasible. So it gave us the opportunity to get in there and work together. And so you saw these organizations continue to meet here a year later and discuss those applications, discuss the needs within the community, and really try to ensure that we're investing as broadly and widely as possible to care for as many families as we possibly can.
Yeah, that actually sort of fits into a question I was going to ask about what did you see as the greatest need in the community starting with the onset of the pandemic, and has that changed, a year since?
What I would say is that I would bet everybody that is watching or that has just been paying attention over the last year has been simply shocked by the number of people that are food insecure and how close it is and how easy it is for families to be sent over the edge. We had been sharing that message before COVID. COVID really shone a light on how prevalent and how tough it was for families who were doing all the right things, working hard, working multiple jobs at times, and unable to provide just their basic needs. Once things started to shut down and people started to lose their employment, then it got even worse. And individuals and families that never experienced the necessity to seek help before found themselves in need of assistance. And so we continue to see challenges with food security. And that is something that we have to wrestle with as a community. It's not unique to Tarrant County. It's happening across our country. And my hope is with some of these federal resources that are coming down that will help to stabilize some of these families, especially in the area of homelessness, or people that are on the verge of becoming homeless, that less of their income is going toward paying for rent, and that they would have more monies available for childcare, for food, and healthcare needs, and just other basic needs that they have. But that was probably the biggest surprise to everyone else. Seeing lines with thousands of people waiting for food from the Tarrant Area Food Bank. And if you do nothing else, they continue to do unbelievable work along with having the National Guard. So if there's ever a day where we get threatened to have the National Guard go away from the food bank, we all should rise up and go advocate on behalf of the food bank. We need them to stay here to help continue to share these resources with our families.
I thought the lines at the food bank were the best measure of the pandemic. And you'd see
Really
Lexus, you'd see rundown cars, and you'd see Lexuses in those lines.
A lot of people who we never expected to be in a food bank or in a food line were. And, as you look at the decisions that were made, what you realize is there are consequences to those decisions. And that's why having mental health, having workforce, having some childcare and some of those other groups in those meetings reminded us of the consequences of the pandemic. It wasn't just COVID-19. It wasn't just, whether you were sick or not sick. When we tell everybody to stay at home, that meant that the abuser stayed at home with the family. It was very, very difficult. And you really never, there's no way of knowing the right answer or the wrong answer. You just had to try to make the best answer at the time.
And I know we've seen some suicide rates go up as well, and that's got to be. I don't know, Lee, if you want to talk about anything you're doing on that score, but that's got to be concerning as well.
It really is. We already were experiencing high rates of suicide, and to the judge's point, when folks are unable to move at will, it certainly causes people to react differently, and many people have been unable to handle just the stress of either losing work or what's happening inside their home. And so there's many organizations that are doing great work to help to provide counseling services, to provide training. So I'll give you an example with Jordan and Elizabeth Harris Foundation. They provide tremendous training especially to young people, so that they can identify potential behaviors within their friends and peers and help them through. The same thing with MHMR, with Mental Health Connection, and honestly, our hospitals as well. I mean, all of those entities are essential to make sure that we have the resources available. We do need more mental health care professionals in our area. When we look at populations and large populations around the state, we are a little underutilized, under-resourced rather, in terms of mental health care professionals for the population size that we have. So we really need to do more to attract those types of professionals here.
Bob, I think I'd be remiss if I didn't also just throw in general healthcare as well. I believe it was April, May, and June, there was a 40% reduction in diagnosis of cancer across the United States. And it wasn't because cancer just went away because of the virus. It was because people were afraid to have the normal screenings that they have for cancer. And so you had a lot of folks that were avoiding care, delaying care. We're starting to see some of that ramp back up, but those screenings are every bit as important today as they were before. And so in addition to the mental health issues, there's also a lot of just general health issues that people really need to pay attention to and make sure that they're addressing going forward, because it is safe now. It's certainly, we know how to be safe now. We know so much more than we knew a year ago, but it is safe now to get that preventative care.
And I should point out those physical health issues can actually lead to some mental health issues down the line if you don't take care of them. This is sort of on the same subject, and I'll start with you, Mike. How did you keep your staff motivated when they were obviously at times very overworked? And I'll ask the rest of you that too.
Yeah, I think we saw kind of some phases, I think, as it relates to the pandemic. In the early months, it was really kind of galvanizing for the entire team, because everybody felt like, you know what, we're the tip of the spear right now, and we can really help these people. And if they get sick, we can also be on the forefront of public education related to how to deal with the disease and how to avoid the disease ideally. Everybody forgets that initially the CDC and World Health Organization was saying, don't wear masks, they don't work. And I think part of that was to preserve PPE, but then everything switched and we were supposed to wear masks. I think we all know now there's enough evidence that they work. But trying to make sure that the public understood, trying to make sure that the public had access. We went almost overnight. We have had a outstanding platform for digital healthcare for 4 or 5 years now, and you can literally do video visits on your phone. We've had that for years. Nobody ever used it. There was never a demand for it. But man, when March, April, May hit, we went to virtually, I think it was somewhere in the neighborhood of 80% virtual visits with a physician across our system. Wow. And so having that infrastructure available and ready to deploy, and we're still sitting at about 15 to 20% on any given day. So we've had a huge uptake in that, much like today with Zoom. But it's analogous, but just the healthcare use of that. And so that's been very successful for us. And I think it really wasn't until the late fall last year where people really started to just get fatigued, because you really started to wonder, this is before the vaccines were available and before the monoclonals were available. It just seemed like everything we tried just didn't help these patients as much as it would help a patient with some other kind of disease. And there has been a lot of mortality across the United States related to this virus. And so that just wears on you day after day after day after day when it just continues to happen. And so we've had a lot of wellness options. We actually started a whole new kind of wellness campaign for our staff to really kind of focus on resiliency, making sure that they were taking breaks when they could, spending time with their family when they could, all those things, but even offering mental health resources if they felt that was necessary. We had groups that would get together and talk about their experiences, so like the critical care teams and some others that were taking care of similar types of patients. We did a lot to really support our staff and kind of coin the term. It was kind of all under this umbrella of safe care. And it was safe care for patients, but also safe care for our teams that included mental health support.
Did you have any staffing issues during this time?
We did a couple of different things, but what's been amazing to me throughout this pandemic, less than 1%, it's something like 0.78% of our employees that were working directly with COVID positive patients ended up with COVID. And even in that number, you don't know how much of that may have come from a spouse or a friend or a relative or a trip to the grocery store or whatever. Less than 1% is really a pretty amazing number. And I think most of the hospitals in the Fort Worth area for certain were in pretty similar boat. But we did, especially during the 2 major peaks that we had, spikes, we had employees that came down with it from a community acquired event. So they'd never been in contact with a COVID positive patient in the hospital, yet they still ended up with COVID. And so that was just like the rest of the community. They were out in the community too. And so that created, during especially the spikes, some significant challenges. The other thing that was very interesting that we all experienced was a lot of the agencies that are available for staffing across the United States, as one state would peak, those agencies would call our staff, ICU nurses and all respiratory therapists, and say, hey, we'll pay you triple your normal pay if you'll go to Idaho and work as an ICU nurse or wherever the spike might be at that particular time. And all of us lost a fair number of employees to that activity, which created a big challenge for us just to keep everything staffed the way it needed to be to take care of patients.
Because then you've not only lost a person, you also have to retrain someone to take their place.
Yeah, and I will say too, another thing that was a godsend to all of us is federally funded workforce. So it's called RAC staffing, RAC, but it basically was allocated through our trauma group. And for those facilities that were highest hit, you could ask for staff to assist. And in most cases, these were top-notch clinicians that were able to come in and fill spots for us without a lot of training. And we still have a handful of them here. We've slowly been winding those down and will likely be completely finished with them around the middle of May. But they have just been fantastic and a tremendous help.
Judge Whitley, what about you in terms of keeping your staff motivated, et cetera, but particularly the public health department, which probably has never been on TV as much as it has in the past year?
Definitely so. And you're exactly right. They've been working, around the clock, 6-7 days a week, along with many of the employees at JPS, as well as, several of our other employees. And, I just can't say enough good things about them and the job that they do. We were yelling at them, we wanted more tests. We were yelling at them, we wanted more vaccines. And they just, they were there working day in and day out, answering questions, trying to get people to, wear the masks and do the things that we could do to try to help prevent the spread. It was truly very, very rewarding to see the employees work the way they did and put in all the time that they did. I mean, remember, you got jailers that are there guarding the prisoners 24/7. And, they couldn't just say, well, you guys turn the lights off when you get ready to go to bed. And it was very, very rewarding.
We do have one comment here. I'll say this because it's a nice pat on the back. It says United Way has done an amazing job. Thank you. What are your priorities from this point forward?
Well, several, we went from the pandemic into another emergency back in February that has also got our staff continuing to work hard to stabilize a few families that have had substantial damage from the winter storm Uri that we experienced. And so we are looking to really get families on a stable footing. We want people to know that they have a solid roof over their head. They know where their next meal is coming from, that they're employed where they want to be employed. They're able to earn what they need to earn. And so that means for us, we do need to continue doing some of the things that we have started, especially during COVID. One thing that has really been a blessing out of COVID is the number of organizations that are routinely coordinating our efforts. And one such example came kind of directly out of kind direction from Judge Whitley. Here being on all these calls and hearing, this group's doing something on food and this group's doing something on food. Are y'all talking to each other? And so we now coordinate a food and nutrition resource group that includes school districts and nonprofits and daycare providers and the like. Our priorities would be things like that, to continue having that coordinated effort so that we're able to scale and not duplicate, and so those are the types of things that we will be focusing on going forward, is ensuring that as many people as possible are able to benefit and to get back on their feet as we start to open up more and more people are able to get back to work. It's going to make it a lot easier for these families to do what they need to do, and it'll make it easier for the social service organizations to support them in the way that they need.
So now we're open basically 100%, at least if you look at the ballpark, the past few days. I'm just wondering if y'all think that we're out of the woods, and what do you think our next step should be? I'm
I don't know
open.
if I'd say we're out of the woods. We've still got a lot of vaccines to give, and we need to continue to work on that. We still need to be very cautious as these new strains pop up. You know, the thing I guess I was most disappointed in was that throughout the last year, this became a political issue. It should never have become a political issue. And I think as a result of that, that slowed the effort quite a bit, because it was, the mask issue was so polarizing. And when I put the mask issue in, a week before that, I had spoke to a group and said, well, I wasn't going to do the masks. But then a week later, it was after we were coming up on 4th of July. We had just come off Memorial Day. And I was afraid we were going to have to shut businesses down again. They'd started talking about that. And for me, it just seemed like, yes, I knew it was an inconvenience, but it was an inconvenience and it wasn't somebody losing their job. So those were the kind of things that we went at and we looked at as we went through that process. So, we've got to get the vaccines. We've got to get people to sign up for the vaccines. We're now getting more vaccines. And I really think that we're very close to the point to where we'll say, either one, call and make an appointment, or here's a place where you can go and get vaccines and people can just go and get the vaccines, as opposed to having to register and do that. I mean, right now, what I would tell someone is to register in all the surrounding counties and all the pharmacies, because if you do, you're going to find some place where you can probably go and get the vaccine the next day.
And I think the numbers I looked at yesterday were about 16%. Is that right?
I think that's about right.
Yeah.
But that's going to be climbing pretty. We've had a lot of problem reconciling and getting the state to accept a lot of the data that we're sending down there. And last week, at one point in time, the state was saying, well, we're getting in trouble because it only shows that you vaccinated 50% of what you sent us. Well, when we actually got in and looked at it, we had vaccinated almost 95%. Their system at the state was not equipped to collect all the data and to get it into the system. And we found the same thing when it came to recording the tests. So when this is all said and done, we need to look at finding a way to make sure that data translates better to the state and vice versa.
Yeah, that was one thing I noticed in reporting on this, was that the state data sometimes did not reflect the county data, and maybe even sometimes the city data, and that could throw you off on just what was actually happening. I'm sure that could be confusing to you as well.
Last week when I was talking about, we had administered about, I think it was 750,000 vaccines. The state had us right at 371.
Yeah.
Huge difference.
I'm going to combine these two questions from the audience. They're kind of similar. One is what lessons we've learned from this pandemic. Then another question pretty similar is what was done right and what was done wrong. How could all of us improve the process and approach for what could be the next pandemic on the horizon? That may be a whole other webinar, but go ahead.
I'll start at least with some of the things that we learned, certainly. But I'll preface it by saying, as a species, we tend to forget painful things pretty quickly. And I kind of hope that doesn't happen, because, the last time the country and the world experienced this was back in the 1918 flu. But, we don't know what will happen next year. I think the judge's point earlier, we're not out of the woods. We've made a lot of progress, and I think there's definitely a light at the end of the tunnel, but we're not to that light yet. And so I think a lot of the things that we've learned about infection control, a lot of things, like one of the most amazing things to me, and I'm a pharmacist by training, is the vaccines and how quickly they got to market, and how pioneering the United States specifically, but with certainly help from Europe, was able to make this happen and really kind of save the day. Because if vaccines weren't around today, we'd all still be sheltered in place and not experiencing any liberty that we've experienced over the last 60 days. So I think there have been a lot of lessons that we've learned that I know in healthcare, I think we will definitely remember those. And if you remember, it wasn't that long ago when DFW was dealing with an Ebola problem. And we learned a lot there. And there were a lot of things that we put in place in hospitals related to that. It wasn't a pandemic, but that outbreak that we continued to manage because it helped us better understand infection control practices. And I think that's certainly been true with the pandemic.
Yeah, and I would say that for leaders, and I'm sure many of the people who are on watching and participating with us today, I would venture to say that the majority of us have not been highly experienced leaders in leading primarily remote operations and leading your team in a way that helps them to still feel connected to everyone else when you are physically separated. And so that was definitely one of the things that, our group went out of our way to ensure that we were reaching out directly to each individual member of our team so that they would hear. We have the benefit of being smaller than my compadres on the line here with me. There's 75 of us, so I can make 75 phone calls over the course of a few days and touch base. And a lot of times, they ended up asking me how I was doing when the purpose of the call was for me to check in on them. But it just goes to show that resiliency that we mentioned. So the leadership part and keeping that organization going was something that was definitely a lesson learned for me. I'm one of those who was so anti-remote work. I mean, like, I was the hater of haters in that. And I will say, I'll be the first to say I was wrong on that. And it's harder to do what you need to do because the ability to shut it off is not as clear. And what we found in the beginning was we had too many people, myself included, that were working too much. And part of the reason was we needed to. It was urgent and people needed us around the clock. However, you reach a point where you need to have some downtime. And so even just modeling behavior, making it very clear, I'm taking PTO and sticking to it helps people to know that you're not just telling them to do it, but when you're doing it yourself, then they feel a little bit more comfortable to step away and to refresh themselves. So a lot of leadership lessons throughout this entire time. They continue, but that self-care and really preaching that self-care and coming at it from a approach of wellness and health and wellness for your team is something for us that we'll continue to have going forward as an organization and part of our culture.
Just in case we have too many type A people on their PTO is personal time off, right?
Yeah. What is that?
I knew that you were the one. Yes.
I think the thing that I would say that we've learned we've learned how to use Zoom and go to meetings. And that goes back to what Leah just said. It's very easy to send an email on a Sunday afternoon saying, look, could I just ask you one question for my newscast this afternoon, or here, there, and the other. And so, there's good times when the Zoom we'll use that and continue to use it because it's an effective way to communicate without all of the time spent traveling. But we still need those face-to-face type of meetings. I think one of the biggest challenges we have coming out of this is how we catch our kids up for the year that they lost in school, because I personally don't believe that virtual learning is effective for most grades in education. So, I know that the school districts are working on this. They're looking at this. They're trying to figure out what to do. And we're going to all have to help. It may mean that we do after hours mentoring or reading or doing, help in one way or another, but we've got to focus on these kids who've lost a year of their, school life this past year. And we've got some funds coming down, and maybe we'll be able to use those funds to help supplement and, catch them back up. And that's going to be one of the big challenges we've got over the next 2 or 3 years is Tarrant County and its cities should receive approximately $856 million. Half of it will be probably in the next 30 to 60 days, and the other half in about 13 months. And I hope that we can get much of that money in the hands of the businesses and the individuals who lost and suffered financially in the past year, and can help them get back on their feet, and can, prepare for what may be coming next that we just don't know about today.
That sort of ties into a couple of things I was going to ask, but one question I definitely didn't want to leave without was, how do you think businesses can be more involved, not only now as we're recovering, but in helping prepare for a possible future situation like this?
We've got to work with our chambers. We've got to continue to work with them and with our businesses to see how we can help them get back on their feet, get their employees back. I mean, I think a lot of your businesses, your downtown businesses, may not lease quite as much space. So it's going to be our goal to, do enough economic development to bring new businesses in, or to create new businesses within our community to fill that space. We learned, there's a lot of things, meals to go. A lot of stuff happened. And I think if we'll just let each one of the local areas figure out what's best for their area, we can go a long way to recovering from this.
All right.
Hey, Bob, if
Sure.
I'm not supposed to speak again till the
Oh.
end of this, but we've got we have probably 10 or 11 questions still in the queue. Judge, I think you may have a time limit, and
I'm fine, Rich.
so we've got a record-breaking webinar crowd here today. We've never had so many people sign up, almost 250 or more. So if you'll bear with us, I'll turn it back over to Bob, and Bob can. Some of these questions have been answered, and some of them run together, as he said. But so for our audience and for the panelists, if you'll give us some more time, we'd like to get all the questions answered. I know you would, and I know as a sponsor, the United Way would as well. So we'll just go as long as we can get the questions answered. At some point, we'll run out of those questions, hopefully, and move on. So I appreciate your time, Bob. I just give you a little more time to move through the questions you have.
Yeah, we kind of got some here at the end. So, but they're good. They're good questions. One of them is about the pandemic crossing basically economic, demographic, and racial lines. I'm wondering how resources were distributed equitably, and what types of outreach were done. That's probably more for Leah, but maybe some of the others want to talk about that too.
Yeah, I'll start off with saying that it gets to the need to do a single application. So that North Texas Cares portal that we talked about, organizations of all sizes that were serving populations throughout our county were encouraged to participate. And so I know for us personally, we reached out to several smaller organizations that may not have even been aware that this was available, because it wasn't only nonprofits, but also faith-based organizations as well that had the opportunity to go there and apply for resources. I'll give you a perfect example. We were one of those that got into the PPE business. I think the county started with it and it got quickly overwhelmed, and they could have used all their resources just trying to distribute PPE, and they had obviously more important things to do, but had a good partner in us and turned that over to us. And so through, oh gosh, probably several dozen and maybe even approaching a couple of hundred different organizations, both churches and nonprofit organizations, small and large, that were able to come through. We created an online portal. You put in what your order was, and based on the inventory that we had at the time, we just set up a drive-through. You bring your printout to show what you were ordering. We load it in your truck and get it on your way. By the time it was all said and done, we've probably distributed more than 2 million pieces of PPE, mostly masks, but gloves, hand sanitizer, and the like. And really for us, it was important to include not just nonprofits, but the faith-based, because we wanted to get down to church-based daycares that might have still been going on, and other programs where they were serving food to some of the folks that are homebound. The other thing that's important, and I think that there's a question just about, how are you making sure from an equity perspective that resources are being applied that way? And that's a question that we ask on our applications. And so we want to know who you're serving and where you're serving. But also, there's daily information that we were getting from our 211 resource, which told us where people were calling in from, what they were calling for. And so we could be very specifically focused on where those dollars needed to be invested based on what people were calling for. And we could see each week, I would provide that update. The number one thing people are looking for is rental assistance, or they might have been looking for support with utilities and those kinds of things. And so we partnered with organizations in those specific communities to be sure the resources got distributed as equitably as possible. So that's just a couple of examples of how we were very intentional and deliberate at reaching out to all corners of our county.
And I think I would add, certainly the health disparities issue became pretty front and center throughout the pandemic as it relates to resources that various people have of all walks of life, certainly. But I think one of the things, literally yesterday, I got a report. We stood up a vaccination program with TCU, and you literally kind of drive around the football field and get your drive-through vaccine. And this weekend, we're doing 3,000 people on Saturday. And so we've been excited to offer that, but I got a report yesterday of the thousands and thousands of people that we vaccinated, and they're off the Tarrant County list that we've been working in partnership with Tarrant County and Vinny and his team. But 26.7% of our vaccinations were administered to people from underserved zip codes. And so we've tried to do a lot of outreach, especially now with vaccinations, to protect those people that might have more health disparities. And I don't think by any means anyone has done enough to do that, but I think everybody, and certainly every health system in the DFW Metroplex, is very aware of the need to make sure that the underserved are properly served when it comes to their healthcare needs.
That has been a goal of ours from the very beginning, was to raise those percentages. We're doing individual registration outreach to those lower income areas. There was issues, there was, again, from a political standpoint, and I wish that it was not in there. And I really think it was a distraction. But with the Hispanic community, they were concerned about, their legal status. In the Black African-American communities, they were guinea pigs in the past. And so there was that concern. And in a lot of instances, what we've got to do is me standing up in front of a group and saying, you don't have to worry, is not the same as, bless his soul, Father Hasso. If Father Hasso had gotten up in front of the Hispanic community and said that, they'd have believed him. And the same thing with the African-American community. There've got to be people who they trust. And in many instances, those are going to be the physicians who they trust and who tell them that it's okay. This is something you need to do. And we've just got to do a better job of that in the future and do everything we can to try and not make it a political deal, either one way or another. The masks were the prime example this time.
Any ideas how you accomplish that? How you stop it from becoming a political issue?
I would say that both parties and leaders in both parties have to stand up and say, that's not right. This is not a Democrat or a Republican issue. And I just don't think enough leaders stood up this time and did that. And in some cases, they did just the opposite.
All right, we have a truth in advertising question, which is someone who says, I haven't heard much people talk about reimagining our community now. So it's pretty open-ended. But I think it is a good question. If you could reimagine our community changing after this, what changes would you see? What would you like to see? Leah, it's probably a good one for you.
Yeah, and I will say that while maybe those precise words were not used, I do think that you heard each of us share what we expect and look forward to in the future. So one thing that I shared is the collaborative efforts that emerged and worked so well during COVID that I fully expect to continue going forward. Just the sheer ability to communicate with other leaders within the community across sectors, it just wasn't established in such a formal fashion before. And now it is, and not just established, it's the norm. And so what we should be doing is identifying, let's use education, for example. And one big thing that we learned was that there were so many sections of our community that have either poor or no access to high speed. And so we say the schools are closed, everybody get online, except I can't get online, or there's multiple kids, but there's not multiple devices, or mom and dad are trying to work from home. And, we all know those stories. So if those types of things exist today, how do we not find ourselves in this situation going forward? Those conversations are ongoing. They're ongoing at a local level, but also, I think we're seeing some things happen legislatively that are redefining what some of those things, does that become a utility? Is that a basic need? If you have to go to work online, if you have to get your education online, should that not be available to everyone? So those are the types of things that, in my opinion, we can do to reimagine how we make it more possible for families to succeed and thrive in the future, not only looking at what happened, learning from it and applying those things that worked and fixing what didn't work. And we know that there are some definite gaps out there. And those are the things that we're focused on eliminating, if not just closing some of those gaps here going forward.
And just to maybe build on that a little bit, I think there are a lot of businesses going forward from a reimagining standpoint that are they're going to conduct their business in a very different way. The judge earlier mentioned that a lot of downtown businesses may not have as much rented office space as they've had in the past because their employees have been very productive working from home. And so I think as a community, we need to be prepared for that, but we also need to be thinking about, okay, then what is, Fort Worth 2.0? What does that look like after this pandemic? But I think Leah's point is the most important one, in that the framework to pretty much solve any complex problem is out there now. And it was highly, highly effective, even though most people on the call may not have had any exposure to it. I promise you that just about every entity that you could possibly imagine was collaborating throughout this pandemic, contributing a little and some contributing a lot. And that shifted from month to month and day to day. And so, the judge really coordinated those calls, but that framework is out there now to literally solve whatever comes next. And I think we all know people that we can call on now that we may not have had as close a relationship before in the past, nor did we know exactly how our businesses were connected with the United Way or with other entities, Meals on Wheels, other entities that are out there. You may think, oh, that's just a charity that I can give money to, but no, the services they provide and the resources that they needed throughout this pandemic were very different. And a lot of us chipped in to help with those resources. And so to me, I think having that framework and that infrastructure that's now been tried, tested, and perfected is fantastic.
Yeah, the collaboration was the big thing, and I do see that going forward. Broadband, as Leah mentioned, is very critical. I don't think many of us would have thought that we were lacking in that area to the extent that we were. But as Leah mentioned, you have, 3 kids at home trying to be on the iPads at school, and then you got a mother and a dad that are trying to work, and there's just not that much bandwidth that's coming in. So we have to do more in that particular area. We just got to help one another out, and we saw that. Mike mentioned it earlier. We had CEOs from all the hospitals. Most of the time, they would be competing and they wouldn't be talking that much with one another, but they were all working with one another to make sure that the hospitals stayed open. And that was that was always the top priority.
This is sort of a comment and a question, both. It's a good comment. Online doctor visits were definitely a game changer in this. Could we use some funding to do the same thing with getting appointments with the next available doc on call for mental health care without requiring insurance and accessible devices, et cetera? The mental health impact of what has happened is going to be continuing for quite a while.
I think we have got to begin. I think we've come a long way in the last decade as far as recognizing that mental health is something more than, drugs. I think if we spent just half as much money on the shoulders up as we do on the shoulders down, we would make a significant impact in the mental health of our community, and we need to do that. I actually had a virtual doctor visit this morning. We're still waiting to see the outcome of that. But, again, that's something that we're seeing more and more of. But again, that wasn't for mental, although there's probably a lot of people who think it should have been. It was more for it was for the allergies and things along that type of lines. So we need to get to the point, and there was a lot of that going on. I remember Susan saying that a lot of her visits were now virtual visits or online visits. So hopefully, Bob, you're right. We'll be able to go to a lot more of that.
Yeah, and I do think applying that technology to mental health is a fantastic idea, because I think the community uptake, as I mentioned earlier, with virtual visits was negligible across the United States. And now it's much more readily accepted. So applying that from a mental health perspective, and it is and can be a lower cost option across the board as far as the cost to deliver it. So maybe that is a future solution from a mental health perspective. I think it definitely has some good merit.
Sort of similar question about organization whose employees have been working remotely for the past year and will be returning to in-person work. Are there any tips or resource modules available to help reduce anxiety and fears about emerging from isolation? Leah, do you have any comment on that?
There are a number of articles that I have read and that our head of HR has provided to us to help guide us through this. This is something that is unnerving for many people. It's so funny to me because as much as we all want to be out, being out still scares us a little. And so definitely for us, we are allowing people right now to access our building as needed. There was a time where that was not permissible. And there was actually a time where we did allow that and too many people were coming in. So we had to back it off a little bit. And we're seeing anywhere from 20 to 25% of people access our building today. We also know that there's a decent percentage that do not want to come back at all and that they want to continue to work remotely. And so, we'll allow that, unlike in the past. And then lastly, we'll have space that's kind of, just a hotel. We have a lot of people who most of their day is spent out visiting people, either visiting folks in long-term care facilities or other types of work that takes them out of the building most often, and they come back just to do some paperwork and things like that. Well, if they want to just come by the office, plug in, finish up their reports, and then leave, we'll have space for them to do that. So that's probably the biggest thing that we're having under consideration is what type of space do we need? How should it be set up? And then how do we make sure that we are communicating to our full team what the process will look like to bring us back in a time frame that is as least disruptive as possible. So I'm happy to gather a few links of articles that we're using to help guide us and share those. And maybe if you guys send a subsequent email with a survey or something like that, you can include some of those in there.
Sure. I actually do think we'll probably do at some point another webinar on what the future office will look like, because I think it will look different and feel different when we start going back to work as well. Try to get one more little question in here. I really thank you for your time. It says, looks like that most daycares are still closed. So where do we go from here? That could impact going back to work and such. I'm not sure. The question's a little disjointed, so I'm not sure what she's saying.
There's a lot of daycares that closed. Carol Waddell was regularly on our call. I think we lost maybe as much as 30%, maybe even more of our daycares. There is a tremendous amount of money coming in the new ARPA, as well as we had money left over from that. And there's a lot of money in workforce development for childcare. So hopefully we'll be able to bring back many of the childcare facilities. What I've always pushed for was quality childcare. I want somebody who's doing more than putting them in front of a TV and handing them a snack. I want them to be teaching them things. I tell the story that my wife was a first grade teacher when we got married back in 1976, and they were starting this brand new experiment called kindergarten. And it was because kids weren't ready for first grade. And 45 years later, we're starting this thing called pre-kindergarten. I just don't want it to take 120 years for us to realize we've got to put them in a quality childcare situation from the very get-go if we're going to have these kids ready to face the challenges of tomorrow.
There we go. I think we've answered to some extent most of the remaining questions. But if y'all have any final comments, we'd be glad to hear them. Leah?
Yeah. First, again, just thank you for hosting this today. It's been great to listen, to share just some experiences and to dream for what our community can and should be going forward. There is no lack of desire on the part of people who work across sectors within this county to see us succeed and to do that together. And so I'm really encouraged by what the future holds. Even if we take our time and get there, we need to be doing that together and ensuring that long-term, as many of us are able to succeed and thrive as possible. I'm really also looking forward to continuing to work with these two guys that are here, but also, so many others within the community. There are big things that are ahead. And I think that each of us will do our part to ensure that we're able to accomplish those things on behalf of the residents of Tarrant County.
Rich, Bob,
Michael?
thank you all for doing this. We appreciate it.
Well, you're welcome. We had one final, Bob will probably ask me, Bob Francis will say, why don't you be the moderator? And I'll decline. We had one question come in late that's somewhat controversial, and I'm not certain about the accuracy of it, but it said, why did Tarrant County lift the mask mandate before the governor did?
Mike, you want to answer that?
We want to end on a tough one.
Well, let me tell you what happened in that regards. The governor came out and said mask mandates are lifted. Now, he said next Wednesday. If you read the headlines in the other paper in town, every one of them said mask mandates, masks, thing of the past. you had to read down in deep into the article. Sometimes even in the article, it didn't say the 8th. So what I said was, it's already going to be very confusing to folks. They're going to go into the businesses. Somebody's going to say, well, no, it's not till next week. And they're going to argue with them. And there's just going to be disruptions that don't need to be there. And so I just took that mask mandate off so that the businesses didn't have to be the bad guy in the deal. I have no idea why the governor said, well, I'm lifting the mask mandate. Oh, but wait, next week. So I just lifted it. And I think a lot of people have asked that question, but that was my answer.
We've required masks here at the hospital since the CDC recommended it. And within an hour of the announcement, we had people coming in the hospital saying, the governor says I don't have to wear a mask anymore. So it absolutely happened, and it was unfortunate. I think there's also been a lot, it brings up a broader issue of just communication. There've been several questions asked today about, how do you depoliticize things? But I think the media helped sensationalize some things that probably didn't need to be sensationalized throughout this pandemic. And that's been unfortunate as well. Because the governor also said, I still expect everyone to behave responsibly. Well, that was never in any article that I read about when the mask mandate was lifted. But I think most importantly, is as fact-based as we all can be, I think that helps eliminate and reduce some of the politics associated with some of these issues. Early on, there weren't a lot of facts to go by. It was so much conjecture and so much hearsay. And for whatever reason, it just became very polarizing, which is very unfortunate. But my hope going forward is that will stop.
Both very, very good answers. Mike, you didn't have to bring the media into it, did you? I mean, to close it out, but that's okay. We probably agree with you. Leah, we are greatly appreciative of your efforts in the United Way to sponsor this. It was your idea, your organization's idea. This is by far the best webinar that we've done, biggest audience, a lot of information, clearing up a lot of misinformation. And we appreciate the opportunity to do this. We've had to change our business model. We now reach over 100,000 individuals a month online and with digital. But let me tell you, we did not have that a year ago. We do a podcast every week for an hour, and we're doing at least one webinar a month. Those are all different. We no longer have an office. We all work remotely. And I can tell you, Leah, when you look at what people want to do, none of our employees want to come back to the office. I don't know what that says. Some of them have been implied that there are certain people they don't want to be around. I don't take that personally. We will, by the way, we will notify everybody who signed up for the webinar. We'll tell them they can go to fortworthbusiness.com and watch it again. And Leah, we will also get with you, and we'll provide the links that you mentioned that you have. So Bob Francis, thank you. Judge Whitley, Mike Sanborn from Baylor All Saints, Leah King, we really appreciate your time and the information, and good luck with it all. Thanks for your leadership.